These are the flashcards for clinical correlates for module number 3. So we're going to start with your quiz questions. So I'm going to be walking around a little bit in this video because I want to be able to show you some of the stuff that I'm talking about. And we're going to start with those quiz questions, so you can pause the video right now and write down your quiz questions and then restart it in just a moment. So when we talk about pulmonary patients in general, we're going to be talking about some of the breathing strategies. And there's a couple things that you need to know about breathing strategies. So our first is our pursed lip breathing. So pursed lip breathing, it means that you're inhaling through your nose and exhaling out of your mouth. So I tell my patients, hence the pursed lip, inhale through the nose, exhale out. The pursed lip actually slows down respiration, and the patient's able to empty their lungs a little bit better of all that carbon dioxide. So a cue might be, smell the roses and blow out the candles. Second, we know the work of breathing is through inhalation. So ideally, we don't want to tax our patients twice. So we have them move, and we have them move during the exhalation so that the lungs are relaxing and they can focus their effort on whatever movement you've asked them to perform. So if they're standing up, they might take a deep breath in and then they exhale and stand up. Diaphragmatic breathing is very important. Our abdominal muscles are nice and strong. We have a lot of our patients who have COPD, emphysema, all of our pulmonary issues. They breathe through their chest, so they... Instead, we want them to breathe through their abdomen so that their abdomen is doing the work of breathing and makes much more stronger control of their breathing. So I might actually give them the cue and put their hand on their belly, and they have to breathe out all the way through their diaphragm. Patient positioning is important. Remember, when we lay a patient completely supine, the chest is heavy, so that makes it harder for our pulmonary patients to breathe. So we may need to want to elevate the head of the bed a little bit. That helps the diaphragm because gravity pulls the diaphragm down and we don't have the weight of the chest anymore. So that may actually impact how well a patient does. So patient positioning, specifically, don't lay them flat. You may want to elevate that head of the bed. Posture for lung opening. If you sit or are standing, however you're watching this video, and you hunch forward, okay, so you've hunched forward into this kind of rounded position that we might see someone who's using a walker, okay? If you have that hunched forward position, okay, I want you to try it too. See if you can take a deep breath. You can't expand your lungs because you have such poor posture. So we want to work on upright positioning so you can get good chest expansion and really inflate those lungs. Remember, exercise is going to use an increased amount of oxygen. So we need to be watching that oxygen saturation, monitoring throughout exercise with a pulse ox to make sure that our patient has sufficient saturation. The Borg. The Borg is a rate of perceived exertion. So it's a patient's ability to identify how hard are they actually working. We find that in general with our pulmonary patients that heart rate is elevated to compensate for the lungs not working very hard or not working very well. They're pretty hard working, but they're not working well. So that heart rate increase could actually throw off some of our measures, and we might not realize that a patient is working hard enough or too hard because the heart rate is deceiving based upon their lung function, because that would be a compensation, would be to see an increased heart rate or tachycardia. So instead, we'll rely on the patient telling us how hard you are working. And obviously a more severe patient, we don't want them working as hard as someone who is less pathological. Okay, so let's talk specifically about emphysema. So we do pulmonary rehab down at the Hug Clinic, but pulmonary rehab is where we are strengthening a patient's lungs and body in order to make sure that they can function at a higher level. Usually this involves a care team, much like our cardiac rehab. Our pulmonary rehab is going to include nutritionists, is going to include the PT, nurses, doctors, and the respiratory therapists. So we will be doing exercises with these patients. Also, we need to understand that with emphysema and with all of our lung pathologies, but specifically with emphysema, usually these patients don't have as high of a saturation, and that eventually leads towards a decrease in muscle strength. Specifically, our COPD and emphysema patients have a reduction in what's called an ankle strategy. So when you are standing there and someone comes up behind me and pushes me, the first thing I do is raise up onto my tippy toes, and then I swing my arms behind to prevent myself from falling. I might step forward. Those are all balance strategies so that I don't fall down. For some reason, our patients with emphysema have a reduction in the ankle strategy, so they don't come up onto their toes and they don't step forward as quickly. And if you don't step forward as quickly, your body goes, I can't even fake it, right? You go straight down and you end up on the ground. So they have an increased fall risk because of that lack of ankle strategy, so working with them on balance and coordination is very important. Pneumonia. Prevention of pneumonia is what we're looking for. So oftentimes we are not treating the patient with pneumonia for the actual lung pathology, but we are treating them to make sure that they stay strong. You can see 30 minutes of PT a day for a patient who is in a skilled nursing facility or a hospital can reduce readmission rates. So a readmission rate is really important to us because hospitals get paid less if the patient is readmitted for the same diagnosis within 30 days of their discharge. It means they weren't ready to go home yet. So ideally, we want to reduce that number. So in the physical therapy group, only 11% were readmitted. In the control group, 16% was readmitted. That's a pretty good change just with 30 minutes of therapy. So it shows that PT is effective. Making sure that we don't spread germs, very important as well. Follow those standard precautions. And finally, cystic fibrosis. You're going to be covering all of this information in PTA 208, but we're going to touch a little bit on it right now. Postural drainage means that you put the patient in different positions to help drain stuff out of the lungs. So for my lower limbs, my lower lobes, the patient would be completely bent over and their head facing down while their chest is elevated so that it drains all that mucus and extra gunk that's sitting in the lungs. It uses gravity to drain it out. Vibration and percussion, so you can put our hands on a patient and shake your hands. Okay, we can use these percussive instruments. So I would actually take this and I put my fingers around it. It's got it's probably about this big, okay, and it's got a hole on the inside. And I take it and I pat it over a patient's lungs. Okay, different sections of my fake patient's lungs here. A therapy vest, actual vest that goes on a patient and would vibrate while they are using some sort of nebulizer or maybe taking some sort of medication. Teaching a patient how to huff cough. Now this sounds kind of weird, but a huff cough is exactly what you are saying. So telling a patient when they cough, and they can use their hands to assist too, that they go huff, huff, as loud and as forceful as they can to dredge up all the stuff from deep in the lungs and get them to cough it up. Because ideally we want them to spit that stuff out. We don't want it sitting in the lungs. Because if it sits in the lungs, it grows stuff, and infection is a huge problem for our patients with cystic fibrosis. We want to make sure that they are getting up all that extra mucus and watering it down as much as possible with medications during their therapy vest time. Exercise is important for a lung function for these patients, but we need to make sure that we are tapering it correctly because breathing is more work for them. And so they are going to expend a lot of energy. So we have to be very gradual in how we advance their exercise treatments. Okay, that should be it for this module and this section on our lung patients.